This teachable moment is brought to you by the Jewish Healthcare Foundation and the Pittsburgh Regional Health Initiative. With the goal of reducing catheter-related bloodstream infections, learn how a team from Allegheny General Hospital in Pittsburgh tackled this problem.
4% of our admissions in the coronary and medical intensive care units were developing central line infections at any given time. That's a huge number. We thought 4% was way too high, and we set about developing a program to bring that number lower and eventually to zero.
It's not easy to change culture in healthcare, so we approached it using that human factor. Making sure that every time we had an infection in the unit, we would say, Mr. So-and-so got an infection, and we caused it. And Mr. So-and-so has 3 children and is here because of this, and now we've extended his hospital stay, and this was his outcome, and it was all preventable.
So we formed a multidisciplinary team to help us understand and attack this problem with a vigor. We affectionately called it our bug meeting.
But he's got some interesting things going on with continuous bladder irrigation, so I need to look at that a little closer.
One of the big leaps forward came is once we standardized our processes for insertion and care, we had a dramatic reduction in the incidence of infection.
This card has everything that you would need for different types of lines to be inserted.
We now have a central line cart that we take from place to place that has everything you need. It has reduced the time of central line insertion dramatically. Clear labeling, simple solutions, having everything standardized from room to room to room, such that everybody knows where everything is all the time, every time. But standardization alone didn't go to zero. So we created an online training program for both physicians and nurses. We make them take a test. We require all of our nurses and all of our physicians to renew their certification in central line insertion annually. And we actually even take it a step further, where we have our physicians demonstrate their skills in a one-on-one proctoring session with a mannequin. How to put on gloves, how to sterilize and prep the patient. Excellent. What are the appropriate anatomic landmarks?
And just lateral to the carotid.
And once we're assured that they have these skills, we then allow them to go in the clinical arena and do this on patients.
Education is definitely right up there with one of the most important things we could have done. When I attended the Perfecting Patient Care University, I learned a lot of principles of the Toyota production system that we could apply to healthcare. And it was really an eye-opening experience for me. That week changed the way that I view healthcare.
Not only have we achieved a 0 infection rate in our coronary care unit, we've achieved 0 infections in our trauma unit, very low infections in our surgical units, and it's really a success story that's involved hundreds and hundreds of people working 24/7, 365 days a year. It saves lives, it makes people better, it delivers a higher service of care. And that's how we got started in it, and that's why we're in it today.